Of clinical officers wish to inform the public and all the stakeholders of the resumption of the industrial action effective midnight day, that is 17th day of February 2025, following the failure of the Council of Governors and the Minister of Health to address our concerns and fulfill the commitments made after the suspension of the 21 days strike. Following our previous agreement, that is the Return to Work 2014, there is lack of commitment toward absorbing universal health coverage staff into permanent and pensionable terms, as agreed in our Return to Work formula dated 8th of July 2024. There is a non-dissemination of approved career progression or guideline for clinical officers to the county governments by the Council of Governors. That this is despite our request, which we did by January 31st, 2025, of commitment toward the promotion and the redesignation of clinical officers in accordance and strict conformity to the career progression. This is affecting most of the counties. Failure to provide comprehensive medical cover for clinical officers by some of the county. This is not most, because there are only around 14. Inadequate recruitment of clinical officers to bridge the existing service gaps necessary for realization of the universal health coverage under Taifa Care. To express our deep concern over the ongoing health summit at the Deputy President residence, where critical discussion on the Kenya health reform agenda are taking place without proper stakeholders representation. The Kenya Union of Clinical Officers and other key healthcare representatives have been deliberately excluded, leading to the decision that risk maintaining the status quo rather than driving a meaningful reform. This exclusionary approach is evident in many ways and in the following manner. We have observed discriminatory policies affecting healthcare professionals and the patient benefit packages under the Ministry of Health, unfair favoritism in overseas treatment allocations, restricted access to emergency healthcare services through biased prioritization process, non-objective means testing tools for the patients, skewed procurement procedures lacking transparency and fairness.
When the government lies to want to create solutions and then they go behind our back and don't do what they have promised, then we feel annoyed, we feel dissatisfied, we feel cheated, because we sat down and agreed on a few things, and that's how we were able to suspend our strike in the last 21 days. Therefore, we are here to call out these people and telling them that the 21 days that we offered, because we wanted to show the goodwill as a union, to sit down, have a round table discussion and ensure it's done. But now, because they went behind our backs and refused to do that what we agreed, then we are sorry, we have to down our tools, we have to stay away from our working places. And it's just bad, because with the current challenges that Kenyans are facing to access health services, and then on top of that, the workers now completely withdraw from the working places.
I think the government should now channel that energy that they used to campaign for the AU seat to solve the issues that are affecting us here in Kenya. These issues are health related, and there is a very, very big crisis. The health crisis in Kenya is heading to a level where even a majority of the Kenyans won't entertain.